Hi guys, welcome to my presentation. Myself Ajin Shah. Today the topic of my presentation is structural adaptations to weight bearing. In standing or upright weight bearing activities, at least half the weight of the head passes down through the pelvis to the femoral head, where the ground reaction force travels up to the shaft. These two forces are nearly parallel and in opposite directions, which create a force couple within the momentum. The momentum is equal to the distance between the superimposed body weight on the femoral head and the ground reaction force up to the shaft. These forces create a bending moment across the femoral neck. In this picture, you can see how the tensile force and compressive force acts. Trabecular system. What is trabecular? Trabeculars are the calcified plates of cancellous bone. It acts like a network of supporting beams to provide strength and support to the bones. In femur, there are two sets of trabeculars, two major and two minor trabeculars. Two major trabeculars are medial compressive trabecular system and lateral tensile trabecular system. Three minor trabeculars are secondary compressive trabecular system, secondary tensile trabecular system, and trochanteric system. In this picture, you can point out the five major and minor sets of trabeculars, and note that the zone of weakness of the femur, and in that place there is no trabeculars. The forces of head and the ground reaction force that act on the articular surfaces of the hip joint and on the femoral head and neck also acts on femoral shaft. Next we can see about hip joint musculature. First, flexion. Flexion of hip joint is done chiefly by psoas major and iliacus, assisted by rectus femoris and sartorius. Extension of hip joint is done by gluteus maximus and hamstrings. Abduction of hip joint is done by gluteus medius and minimus, assisted by sartorius, tensor fasciae latae and piriformis. Action is limited by adductor longus, pubiofemoral ligament and medial band of iliofemoral ligament. Adduction of hip joint is done by adductor longus, adductor brevis and adductor fibers of adductor magnus. The muscles which is helpful for medial rotation are the anterior fibers of gluteus medius and gluteus maximus, tensor fasciae latae. The muscles which are helpful for lateral rotation are piriformis, obturator internus and externus, superior and inferior gemellae and quadratus femoris, which is assisted by the gluteus maximus muscle. Thank you all for listening to my presentation.